Cardiac glycosides are drugs used to a. Lower blood cholesterol level. B. Dilate blood vessels. C. Maintain normal heart rate and rhythm. D. Lower blood pressure. While caring a patient suspected for DVT, the nurse should not a. Administer anticoagulant therapy. B. Massage or exercise affected limits. C. Maintain strict bed rest. D. Elevate foot end of bed. The collapse of the alveoli due to obstruction or hypoventilation is called a. Emphysema. B. Empyema. C. Atelectasis. D. Bronchiectasis. Which among the following breathing exercise is most beneficial for a patient with COPD? A. Deep breathing. B. Pursed lip breathing. C. Incentive spirometry. D. Cough exercise. A contagious disease caused by Treponema pallidum by intimate contact or in utero transmission is a. Gonorrhea. C. Psoriasis. B. Pemphigus. D. Syphilis. The number of new cases occurring in a defined population during a specified period of time is a. Prevalence. B. Epidemic. C. Incidence. D. Pandemic. Visual inspection with 5% acetic acid is a screening test for a. Breast cancer. B. Cervical cancer. C. Oral cancer. D. Stomach cancer. The continuous scrutiny of the factors that determine the occurrence and distribution of disease is a. Eradication. B. Surveillance. C. Elimination. D. Evaluation. Progressive non-bilious vomiting after feeding in the neonatal period is a classical finding in a. Malrotation of the gut. B. Biliary atresia. C. Mecca's diverticulum. D. Hypertrophic pyloric stenosis. A congenital heart defect in which the blood pressure in the legs is much lower than the blood pressure in the right arm. A. Aortic stenosis. B. Truncus arteriosus. C. Coarctation of aorta. D. Pulmonary stenosis. Scoliosis is a condition characterized by a. Outward curvature of spine. B. Inward curvature of spine. C. Lateral curvature of spine. D. Fracture of spine. Oval-shaped brim is characteristic of which pelvis? A. Android pelvis. B. Platypeloid pelvis. C. Anthropoid pelvis. D. Gynecoid pelvis. Fundus of the uterus is palpated at the level of umbilicus at which weeks of pregnancy? A. 12th. B. 24th. C. 36th. D. 40th. Inflammation of fallopian tube is known as A. Ophiritis. B. Salpingitis. C. Vaginitis. D. Vulvitis. Which part of the inner ear is associated with sense of balance? A. Semicircular canals. B. Cochlear nerve. C. Bony labyrinth. D. Cochlea. Fertilized ovum is implanted and developed outside the uterine cavity, which is known as A. Hydatidiform mole. B. Normal pregnancy. C. Multiple pregnancy. D. Ectopic pregnancy. Commonest complication of hydatidiform mole is A. Development of carcinoma. B. Sepsis. C. Incomplete evacuation. D. Perforation. Where is the site for lumbar puncture in adults? A. Second lumbar vertebra and third lumbar vertebra. B. First lumbar vertebra and second lumbar vertebra. C. Third lumbar vertebra and fourth lumbar vertebra. D. Sacrum and coccyx. Where do the erythrocytes are produced? A. Liver. B. Heart. C. Bone marrow. D. Spleen. Examination with the help of stethoscope is called A. Palpation. B. Percussion. C. Manipulation. D. Auscultation.